Okay, we should be live on our YouTube channel now, so we can get started. If we could do just quick introductions. Again, my name is Nate Perry. I'm the district administrator for the school district of Belleville. Kelsey, do you want to go next? You're the next that I see on my screen.
Sure. Good morning. I am Kelsey Schmidt, the elementary school principal.
Becky, you want to go next?
Sure. I'm Becky Clark. I'm the district nurse here in Belleville.
And Becca?
I'm Rebecca Johnson. I'm the Director of Student Services and Teaching and Learning.
Mrs. Schmitz?
I'm Heather Schmitz. I am the middle and high school principal.
Okay. Dr. Michael, you're up next.
Hi, I'm Dr. Michael. I am a family medicine physician and faculty with the University of Wisconsin. I work at the Belleville Clinic.
And then we also have Dr. Geyer on the phone.
Hey there, my name is Lindsay Geyer. I am a pediatrician. I work for SSM Health at the Monroe Clinic and New Glarus Clinic site. And I've been working with a lot of schools in the Greene County area on their opening processes.
All right, we appreciate you being here. Laura Anderson, who's the infection control practitioner from UW Health, could not join us today. I think Dr. Lochner may be joining us from UW Health Belleville. I'll keep an eye on our entry to make sure that if she does join a little late, that she can join us as well. But we appreciate our two medical experts along with our own district nurse, Becky Clark, joining us this morning. Let me share my screen just to show you our agenda for this morning. You should be able to see this now. And again, Mrs. Schmitz is going to take some notes for us. But we wanted to first recap what happened at our special meeting of the board on November 30th, then look at our most recent numbers. We do have some updates on those for you as well, with some different way that DHS is now presenting them. And then any update, we hope to end with any update from the medical advisory for the school board. I will just remind, I'll stop our share here. I'll just remind the medical advisory that several months ago now, the board had tasked myself with creating the medical advisory as just that, an advisory for the board to help them in making their decisions about how we approach school. Our current situation is still that we are in person pre-K 2. We do have a wraparound program in pre-kindergarten. We are still virtual in grades 3 through 12 at this point. So a recap, and then I'll take any questions that maybe Dr. Michael or Dr. Geyer might have. A recap of our November 30th board meeting. We did once again remind the board that there had been a recommendation coming out of the medical advisory. At that time, it was on the 5 tracks for 14-day rolling average. There was one motion that was made. There was no second to that, and it didn't go any further than that. The board also did not make a decision at that time on a return in January, but that's something that we want to talk more about today. They did request that this group look at post-Thanksgiving numbers, and when we were setting up this email, and we'll pause in a minute for questions and comments, but when we sent out the invitation, I know there was some hesitancy that we may be still too close to the Thanksgiving holiday to look at those numbers, but we'll look at those numbers anyway and get some input maybe from the doctors on the call. The other piece of information that I think might be pertinent for the doctors is that the school district is investing about $90,000 in an air ionization system that will be put in by Alpha Services and Controls, and that should go in the next month or so. We anticipate that the parts are now coming into Alpha. They've got to do some checking on that they have everything, and then we're hoping to have the install relatively soon. We don't have a firm date on that, but that's another piece that we have in. I do want to say one more thing, and that was the board realizes that you are putting in volunteer time for this. They did really appreciate some of the feedback that we had gotten on our reopening plan, particularly around lunches and what those lunches might look like as we bring students back. So that, again, they do really appreciate work. They just have not acted on the recommendations as of yet. So questions on where we were at with the board just a few weeks ago from maybe Dr. Michael or Dr. Geyer. Is there any questions or comments on that?
No, I mean, I guess the one clarification, there wasn't like a push to, I guess, endorse any sort of recommendations. Mainly, was that because it kind of looked a bit dire as far as the numbers and probably not getting back to school this fall?
Yeah.
Or was there another reason?
Yeah. I think the summary that I would provide for the board's overall feelings, again, this was about another 2-hour meeting on this, was they're still concerned with the numbers, but also at the same time, to balance that, they're still concerned that we've now had students out since March in grades 3 through 12. So I think there's a healthy concern on both ends of those from the board.
Sure. Okay. Thank you.
And this is Dr. Geyer. I was part of that meeting, of course, too, our last medical advisory board meeting. And, we were at our Wisconsin peak at that period of time. So it was pretty difficult to make a recommendation about going back when we really didn't know where things were going. I'm sure a lot of you probably follow the Dane County COVID-19 dashboard. And luckily, things have been moving in the right direction, which is super encouraging. We're 12 days past Thanksgiving. We're not fully out of the Thanksgiving. We're not fully 14 days past that weekend yet. But I would say things are pretty encouraging that we've continued to, cases have continued to track downward despite that holiday. I think it's just a testament to a lot of people in the county really did what they were supposed to do over Thanksgiving. So I'm very hopeful that people have their priorities in place. And I think a lot of us are in a much different place thinking about bringing kids back than we were, a month ago when our numbers were peaking. So I think it's a great time to have this conversation again.
And that is a good transition point, I think. And again, for those of you that might be watching us online, we usually only use about 45 minutes of meeting time, just to be respectful of the doctor's times and meeting so early in the morning. So let me share my screen again, and we can talk about those new numbers. So as you know, we've been tracking numbers from just the Belleville area when we had way back when, let me start this share here, way back when we first started meeting. And so the first chart I'll show you is just on the Belleville numbers. And you can see that, this is certainly fluctuated. And again, this is just a census track on that. Our current numbers for a 14-day average were 4703. Remember, if we were to follow the old Harvard metrics, that number for 3 through 8 would be 25, and then 9 through 12 would be 10. We were also, our recommendation to the board though was the 4 tracks, including Belleville, around us. And as Dr. Geyer mentioned, in our current recommendation, this group's current recommendation, we had been in the 50s on these rolling averages. I think the highest we may have gotten, I don't want to misspeak, but somewhere almost around 55 before Thanksgiving. We're now down to a 14-day average of about 4173. So that points to what Dr. Geyer had just said. The other thing that I want to share briefly with you, and let me see if I can do this. Sorry about this. Here we go. I'm going to see if I can get the right dashboard up. Can you now see a map on your screen?
Yes.
Yes, Nate.
Okay. I just asking for confirmation because this is a little bit different for me than a Google Meet. So I believe it was last Thursday, we knew that DHS was going to give us Belleville specific information, school district of Belleville. And so that information is now up and we've been collecting that. We've also gone back as far as we could to start creating 7 and 14-day averages because as we had discussed from the start, and I don't want to misspeak, so maybe Dr. Michael and Dr. Geyer, you could chime in, but I believe at that time we went with the four tract census area for a recommendation because we didn't have Belleville School District specific information. Now we do have that information. So let me just pop back and show you what that looks like. And so it follows a little bit similar trend where you can see in October, we were in the orange, would have been able to bring back 3 through 8. It had turned red. Those numbers are kind of in between the Belleville only and the 4-track numbers. The current 14-day average for the Belleville School District only was 49.23. I can tell you again, to Dr. Geyer's point, we had been much higher than that, and it has come down fairly significantly now in recent days, and hopefully that trend will continue. So that's the newest information we have from the state, and I am happy. I'm going to stop sharing now. I am happy we finally have Belleville School District data that we can look at instead of 4 census tract data that we weren't really sure who was in our district and who was not. Any comments or questions on that before we talk a little bit about maybe any updated recommendation that the committee might want to make?
Nope,
This
nothing.
is Dr. Geyer. Oh, go ahead. Go ahead, Dr. Michael.
No, go, Dr. Geyer. I wasn't going to add anything specific, so.
Oh, okay. So Dr. Geyer again. You know, it's great that we were able to have Belleville district data now. I think it's wonderful that they were able to provide that to us. And I appreciate all the time people have put into pulling all this data. A lot of you may have kind of heard that, you know, we've always really looked at the Harvard group as just a really good unbiased organization for just providing the information we need to get kids back. That's why we've always followed that model. But we have reason to believe that they're going to be coming out with some new recommendations. And just as an FYI, they may actually remove the whole idea of metrics altogether. So I just wanted to kind of put that out there as we kind of think about how much we want to kind of scrutinize these numbers. Just the more and more data that comes out, we're realizing that the level of community spread should not necessarily impact our decision to bring kids back to school, because the community rates tend to be pretty similar whether kids are in school or not. And I'm happy to share, you know, more of that data, but we are actually finding that schools are tending to be one of the safest places. So I just wanted to just throw that out there before we, you know, super heavily scrutinize the numbers, just so that you guys know that hopefully this recommendation is coming soon.
That's actually a great transition. Lindsay and I did not meet ahead of time, but she is leading us into our next agenda item, which is, again, our current recommendation was the old Harvard metrics based on the 4 tracks that we had at that point. I do want to bring up Dr. Allen, from one of the creators of the Harvard metrics. He had a question answer session last week with Dane County school leaders. Parents could be on there as well, but Dane County school leaders. And some of the things that he did talk about were that schools can be a controlled environment. I'm just going over some of the notes that we had taken during that session. I specifically asked about mitigating factors, knowing that the board had already discussed potential dates in January to bring back students. And his top 3 mitigating factors were masks, specifically 3-layer masks, but masking, air filtration, which you heard in our earlier update that we are pursuing and hope to have in fairly quickly, and then hand washing. He also noted later on in his session about distancing. There was some discussion between 3 foot and 6 foot distancing, but he did mention that, even suggested opening windows if possible. He also made an emphasis on making sure for teacher safety and for stopping the close contact spread, that teachers make sure that they keep their own distance and should be able to do that. Remember, right now, 15 minutes within a 24-hour period within that 6 foot distancing. So those are some of the things that he had mentioned. To Dr. Geyer's point again, he did, along with that idea that schools are a controlled environment for students, he did bring up the idea or thought, like, what are kids doing outside of school when they're not currently in school, and is that adding to any kind of spread? He did mention that the cohorting of students would limit quarantine times, and I know CDC is updating their quarantines as well. We as a school staff are working on that. I will just remind this group and anybody watching online that we are still under emergency orders in Dane County, and part of those that have not gone away are the social distancing. So we still do have to abide by those orders that are in place with the social distancing, which I know we've had some requests to come back all in right away, but that makes it very difficult for school staff to try to do that and keep social distancing. And I'm not sure if Kelsey or Heather at this point just want to maybe give a little bit of insight to Dr. Michael and Dr. Geyer about how that might look to the plans currently in place. Just real briefly, the plans currently in place if we were to bring students back, so that we could keep them, in cohorts that would be 6 feet apart. The cohorts aren't in the order, but the distancing is yet in the order.
Sure, I can jump in. Based on the half-day model that we have right now in our 4K through 2nd grade that are in the building, we are able to social distance to the greatest extent possible in our classrooms. I think the most we have in one classroom is 11 students, but beyond that, if we doubled that to about 20 to 22 students in a classroom, we wouldn't be able to social distance any further. So we have had a lot of situations where one class, like the afternoon classes, had to quarantine, but we've been able to keep the morning class in session. And so our cohorting has been very effective up to this point. We haven't seen spread. If there's been a positive case within a classroom or a staff member, we haven't seen any spread within the school building. So we think our cohorting has been successful, and we feel confident about that moving forward with that AM/PM model that we have in place.
Heather, your model would look different at the middle and high school. Do you want to briefly talk about that?
Yes, so at the middle and high school, we would follow what is known as the DPI model, where we would have 2 groups. We would have a cohort 1, which would be face-to-face on a Monday, Tuesday, while at the same time, cohort 2 is participating virtually in 100% synchronous learning as they are now. And then group 2, it would flip-flop on Thursday, Friday. Group 2 would be face-to-face, generally last names M through Z, while A through L is participating in synchronous learning. And then we have talked about Wednesday being an all virtual learning day. Right now, the school counselor and I are working very closely to try to minimize our numbers or keep our numbers at 12 or less with this hybrid model in place in classrooms in the hybrid model. We are very close to accomplishing that goal. We have less than 5 classes that, based on numbers right now with parent registration, the most recent parent registration, if the board adopts to bring students back in the hybrid, we would open up that registration, and if parents decided to change, they would let us know, and then we would work with numbers there. But we feel pretty confident we could keep those numbers 12 or less in a hybrid model. What it looks like if we were to bring all students back face to face, we would have over half of our classes, over 20 students. We would have about a fourth of our classes that have over 24 students in them. And we would have about 1/10 of our classes that have over 27 students in them, which would not allow for that social distancing.
I'll add one more point and then comments or questions from Dr. Michael and Dr. Geyer. From the beginning, even back in July, our plan, even in our reopening plan for the school district, was once we were able to implement the hybrid and do that successfully, then we would transition to an all-in at some type of break, whether that's at a built-in break in the year, beginning of the month, after a long weekend, something like that. But once we were to be able to transition into the hybrid and make sure that we're successful in that model. The other thing that I wanted to mention, just to go back to Dr. Allen from the Harvard model one more time, is he did mention specifically schools sharing responsibility with parents and the community. If this is going to work, we really need the parents and the community to do their part so that the spread stays low and that kids aren't bringing in COVID-19 from the outside. I think Kelsey had mentioned before that we're not seeing spread at school, but we are seeing cases come into the building, and that's where we've had to shut down, whether it's a class, a cohort, and that's the situation that we've had to deal with so far this year. So questions at this point from, or concerns, comments from Dr. Dr. Michael or Dr. Geyer?
This is Dr. Geyer. I just had one question about just the reasoning behind that Wednesday being all virtual for all middle school and high school students. If it's related to, infection control purposes, I think we could argue that that's not necessary. If it's for logistical reasons, from a, transportation or staffing for other, of course, logistical reasons, of course, that's fine. But I'd be happy to talk more about considering, doing making Wednesday in person, alternating weeks depending on the cohort, if you guys are interested.
Could you add that to the notes, Heather? That's something I'll mention to the board as well.
Yes.
Yeah, this is Dr. Michael. I agree with Dr. Geyer as far as like having, I think that originally was supposed to be like a deep clean day, and then also allowed for the transition of the cohorts. But yeah, I think that there's probably other ways to work that out that allows for 5-day school attendance if that's the reason for the break.
Anything else from Dr. Michael, Dr. Geyer? Otherwise, I'll move on to our last few points here today in the time that we have. We have about 20 minutes left, and I'd like to share just a little bit more information and then ask about a path forward. Okay, so let me.
Nope, I'm good. Thank you.
Oh, go ahead. Did you have anything else?
Oh, I just no more comments. I'm good. Go ahead, Nate. Thanks.
All right. I'm going to share my screen one more time here. This is back up on the agenda. I did want to give you an update because we are seeing movement. This is at the bottom here, close to where Heather is taking notes, but we are seeing some movement now within Dane County. There's 3 bullets there. I learned within the last few days, and there are other boards that are currently under consideration that haven't made a determination yet. But Middleton is bringing in students for the first time, K2, that will happen on January 25th. Sun Prairie for the first time did bring in their 4K through 2nd students in a hybrid just this last Monday. And Verona will be bringing in, I'm not sure if that affects your kids, Dr. Geyer, but happy for you if it does.
Yep.
Verona will be bringing back their K5 students starting January 26th. I could have added more detail to those notes, but there are other plans, but those aren't board approved plans. These are what I know of that are board approved right now. So the last 2 points, and I will defer to Dr. Geyer and Dr. Michael on this, is at this point, we still have our previous recommendation from this committee was on the old metrics and the 4-track. I'm not sure if there's if there's a movement to move and make a different recommendation on metrics, and that would be the school district of Belleville only metrics. Or I have another point on there. As I mentioned, I'm going to stop my share now here of the screen so that we can see and talk to one another. The board had mentioned, although did not settle that at the 30th meeting, but the board had looked at dates of return in January. I know there was some concern on this committee's part when we met last about bringing students back too soon after the break, not knowing what that spread may be like after the holidays. But at that time, correct me if I'm wrong, but the committee had mentioned if you're going to bring kids back after those holidays, perhaps waiting those 10 to 14 days might make more sense. Just for your information, Dr. Geyer, Dr. Michael, our semester would begin on a Tuesday after Martin Luther King Jr. Day. That would be the 19th of January. Initially, we had, the administrative team had talked about and had discussed with the board just a 2-week phase-in plan. So we would bring half of our students back on the 19th so that we could get routines and procedures in with half of those students. Again, there's some training to be done, especially with smaller kids. I'm sure Kelsey's thinking about 3rd and 4th grade with where they go, how they enter, how they exit, washing hands, social distancing. And then the other half would come in on the 25th of January. That was the administrative recommendation if the board was going to go with those dates after the holiday break. So input and feedback on that we could take back to the board. Again, do we want to look at updating the metrics and saying we still approve these metrics, but based on Belleville only data, or sorry, my lights keep going off here, or if the board is considering dates in January, would you suggest focusing on those dates and planning as best we can to use those mitigating factors at that point? I'll stop talking now and listen.
Nate, can I ask a quick question?
Absolutely.
Do you know the capacity that Middleton and Verona are bringing back kids? Are they hybrid or are they going?
The only information that I have is Middleton. I don't have that information. This was just sent to me. I do know that Sun Prairie is a hybrid at 4K2. I don't know about how they're bringing those back in Middleton and Verona at this point. And Dr. Geyer,
Dr. Geyer, in Verona, they're going to do. Oops, I'm sorry, Nate.
No, go ahead. I was actually prompting you because you probably know more about the Verona situation.
I just know Verona, and they're planning on doing 2 full days on, 2 full days off, and then having the kids that are on their off days just be tuning in live, so that kids are receiving the same instruction all 4 days.
So, Dr. Geyer, am I hearing you right that they do have the kids split in 2 groups then?
Correct.
Okay. Other thoughts then on our way forward? We do have about just under 15 minutes left that we had planned for today, whether to update metrics and bring those back to the board or to pick dates and not pick dates, but if we're going to pick dates, really working on those mitigating factors between now and then to make sure that we have what we need to bring students back.
This is Dr. Michael. I agree. Dr. Geyer sent out kind of a nice little, well, a fairly long, I shouldn't say little, but a fairly long packet that kind of had a bunch of information. And I think it just underscores a lot of the information from like schools that didn't shut down or places that did, just kind of the, I think it underscored 2 things. One, some of the observational data that we are seeing just from neighboring school district, like neighboring counties, and how they are going back to school and being successful despite high community spread, and private schools in Dane County, such as Edgewood, that are I think K through 8 have been open since, I want to say, fully since October, and K through 2 they've been open fully this whole semester, and haven't had any significant shutdowns or I guess illnesses within the school. So again, that kind of underscores a lot of the studies that are saying, hey, schools are probably the safest place or one of the safer places to be during a pandemic, or at least this specific pandemic. And then the other thing a lot of the data I think is starting to show is that there's obviously a disproportionate, or I should say the homeschooling part is disproportionately affecting people who have certain either high learning needs or lower socioeconomic status, where it's just putting that much more strain on the household, maybe a more difficult home situation, that it puts more strain on the learner, independent of other kind of, I guess, learning considerations or mental health considerations. So, I mean, I think, in my opinion, if we, I think it would be better to reevaluate our maybe dedication to the metrics and look more at picking a date and setting kind of the, I guess, viral mitigation techniques, strategies that it seems like you guys are already employing. So,
Dr. Michael, can I ask just a clarifying question? One of the things you said, you're really concerned about those students that are in a virtual environment right now and have been since March, and just the progress or lack of progress that is being made?
Correct. Yeah. So I think, there have been studies that have shown this, that, right. So certain students obviously are not going to do as well. I think that's, you probably don't need to do a study to say children with, that are maybe on the autism spectrum, or children with more significant ADHD are not going to thrive in that environment. But then you also have to consider too that children who are maybe in a less ideal home situation, or in a situation where multiple, maybe I say less ideal home situation, but maybe just there's a lot of tension at home, and that obviously isn't going to set up for an ideal learning environment, and it's probably just going to add to a lot of that tension. So I mean, there's, I think now we have a lot of data that suggests that it's bad for a couple of different reasons for certain populations, and especially bad for certain populations. So, I mean, I think that picking a date is a pretty, I think, supported by what we're seeing in neighboring communities, and also what certain some of these observational studies that are being published are basically confirming. If that answers your question, I'm not sure if it did.
Thank you. Dr. Geyer, your thoughts, comments?
I am in absolute favor of choosing a date. I do think it's a good idea to wait at least 10 days after the holiday break. People did great over Thanksgiving, but that was a long weekend. So it's hard to know what behaviors are going to be over the holiday break, end of December. I've expressed concerns before, just having been working in Greene County during this time. I see a number of kids that are in, learning in, of course, an in-person environment compared to the virtual environment. And we know the negative effects are just astronomical when kids are learning virtually. There are, of course, the kids who have significant social anxiety or issues with bullying at school that have benefited from virtual learning, but they are definitely in the minority. Just the physical health, mental health, just in general, the well-being of kids in person is definitely much better. And I'm able to see that on a day-to-day basis just within my practice. So, I don't think we can any longer judge the health of children based on a negative COVID-19 test. We need to look at the whole child, and really the best thing at this point in time is to get them back in school sooner than later. And we can continue, of course, to watch the numbers, but I would pay very close attention to Harvard's new guidelines that should be coming out. I think Public Health Madison Dane County should be publishing some new metrics as well, but I would really focus on those Harvard guidelines, which I really hope focus less on the numbers and more about the mitigation strategies to make the school as safe as an environment as possible.
All right. Well, we are at 7:37. We're a little early, but we did get through the agenda, and we really appreciate your time this morning because, again, this information will go back to the board for their regular meeting on Monday. And they'll have that information of what we talked about today, especially in these last 10 minutes or so. Any other comments from school staff or the medical professionals on the call today before we wrap up?
I do just want to add something here, Nate. I am so optimistic about where numbers are headed. I think this is something that we didn't expect coming, but I think that we definitely have reason to be optimistic about where positive cases are heading. And I do think that we have a great resource now in that school district specific data, which gives us a very accurate snapshot of where our community is. So yeah, I think we're getting to a much better place than we were.
And as a district, just so that Dr. Michael and Dr. Geyer know this too, and anybody that might be watching on YouTube, you know, if the board makes that decision to bring students back, as we've talked about here in January, one of the things that we've talked about as an administrative team is really then once we have that plan to promote that within the community and families, that they have a big part in this, about doing everything that they can to be safe so that when we do get students back, that it is a great environment for them and that we can stay open and that we can and continue to roll. Because one of the things that although there are certainly downsides to virtual learning, it has been consistent up until this point. And when we make that, when and if we make that transition to hybrid or in person, all in person, we definitely want to make sure that there's that consistency, that we're not having to go in and out. And we really need the help of families and the community on that as well. All right.
This is Dr. Geyer. One thing I want to just point out, if anybody's looking for more resources, particularly your board members, there's a great website that is the making of the website. It's a project between Portland State University and the Healthy Buildings program at Harvard. But it's school.forhealth.org. So you may already be familiar with it, but they have a ton of great data about reopening strategies, you know, FAQs, relevant research. So just so you guys know, you don't need to be kind of recreating the wheel. A lot of this information has been done, and it's just a wonderful evidence-based resource that I just wanted to point out.
We appreciate that, Dr. Guy, and I'll try to pass that on. I did do a search. I didn't find it right yet, but I will, and I'll pass that on along to the board as well.
Great.
Okay. Thank you for everyone's time today. If there's nothing else, again, we appreciate it. We appreciate you showing up here early in the morning and helping provide some guidance for the district. So thank you so much, and hopefully we'll turn the corner here. It looks like our numbers are going down, and hopefully we can make some progress. So appreciate everything, and we'll see you soon.
All right.
Sounds great.
Thank you.